You're young. I mean, young enough to hike, lift heavy weights, go out on a romantic dinner, and deliver the keynote address. Except that you can't actually do any of that because you were born with a misshaped hip, or you had a bad accident. Congenital hypoplasia or post-traumatic arthritis. You didn't even know you had them when you were young. But the deformity caused an accelerated degeneration. The post-traumatic injury caused an arthritis, and here you are in your 40s or even 50s with a hip that thinks it's 80. The only treatment is total hip replacement. But the orthopedic surgeon says you're too young. And I mean, well, that's wrong. If you were told you're too young for hip replacement, I'm going to explain why hip replacement is actually your only option. And it's a good one. So buckle up. It's going to be a great show. Welcome to Best Practice. The problem with congenital hypoplasia and post-traumatic arthritis is that they affect relatively young people, people in their 40s and 50s. The only known treatment is total hip replacement surgery, and that really works, but traditionally, the hardware in the implants wears out over time. As a result, many people were told they're just too young for total hip replacement, despite having really severe hip pain. Well, the orthopedic surgeon is the expert, right? Kind of. I mean, not all orthopedic surgeons are the same. I like to say that there's actually two different types. Let's call them the legacies and the subspecialists. The subspecialists are fellowship-trained orthopedic surgeons who do minimally invasive approaches using robotic assistance in ambulatory surgery centers. These minimally invasive approaches cause less damage to muscles during the surgery itself, leading to faster recovery, and most important to us, no permanent restrictions. Legacy orthopedic surgeons, on the other hand, are the other guys. They do traditional posterior approaches in the hospital. These approaches take down so much muscle to get into your hip that it literally takes 1 to 2 years to regain full strength. Because the approach weakened the muscle so much, again, your legacy surgeon will give you permanent restrictions to prevent dislocation. These are significant. Things like you can't ever cross your legs, ride a horse, or even just generally be too active. Look, the subspecialists are so much better that you would assume that they do nearly all of the joints, right? Totally wrong. 93% of all total hip replacement surgeries done last year in the United States were done by Team Legacy. So if you were told that you're too young for total hip replacement, the odds are you were told that by a legacy orthopedic surgeon. I mean, as Rodney Dangerfield said, I mean no disrespect.
No respect.
They mean well, and they may have done a great job for your cousin's friend, and the nurse in the office is super sweet. They gave you a shot when you needed one right in the hip last year, and it really helped, but they're just not subspecialists. We've known for 20 years that high-volume joint replacement surgeons have literally half the complication rates of low-volume surgeons. But as I said before, low-volume surgeons, legacy orthopedic surgeons, do 93% of the total hip replacements. Look, let's get back to you. Hip replacement subspecialists will tell you that no one is too young for total hip replacement. No one. And here's why. First, the surgery has changed. This is not your mother's total hip replacement. New robotic assistance, minimally invasive approaches, these things are so innovative that there's just a really low risk of complication and a very rapid recovery. Second, we don't even know how long these implants could last. They're that good. We have 20 years of data from hip registries, and I mean, the total failure rate after 20 years right now is 8.2%. To put that in context, that means there's a 92% chance your hip is going to last 20 years. The failure curve over time is also pretty darn flat, so it's likely to keep right on going after 20 years, and frankly, even if it doesn't, that's 20 years from now. Who knows what kind of awesome options they're going to have to fix it if it's ever broken in the first place. Third, you don't have any choice. I mean, hip replacement is your only option for treatment. The hip is a choke point on life. No matter how good your heart, lung, liver, spleen, knees, everything, no matter how good the rest of your body is, if you have a bad hip, you can't do anything. It all comes down to this. How much pain are you in? No matter how old you are, if you can't live your best life because of your hip, you need to get treated. You still have a lot of life ahead of you. Get treated and get back to doing the things you love while you're young enough to actually do them. For Best Practice, I'm Dr. Dan Lieberman. If you have a question you would like answered on Best Practice Live, click the link to our website and complete the submission form. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health. Lastly, be sure to check out new episodes at 10 a.m. Pacific, 1 p.m. Eastern, where we answer all your questions.